my name is Jocelyn Invernon. I'm a PN student at Williston State College, and today for my skills, we're going to be doing wound care. So to begin, I'm in my med room, and I'm just going to look over my provider's orders. So looks like I'm working with Shirley Coast. Her date of birth is 5/14/1964. Dr. Leo has ordered daily dressing of wound with a wet to dry dressing, change PRN. At 0900, we're going to obtain a specimen for wound culture as well. So I'm just going to make sure before I go into my client's room that I have all of my supplies. It looks like I have my biohazard bag and my culture swab. I also have a label for this that I'm just going to go ahead and cross-check to my client before I go in there. And it is for Shirley Coast, 5/14/1964, so that matches as well. I have a not opened, sterile dressing change tray. I have a syringe, and I have everything to measure. I also have normal saline, fresh gloves, and a kidney basin as well. So I'm gonna go ahead and go into my client's room now. So knock, knock. Hi, my name is Jocelyn, and I'm gonna be your nurse today. Can I just get your name and date of birth? Shirley Coast, 5/14/1964, so that matches her wristband and my provider's orders. I'm also going to make a note that she has an allergy band to codeine, but nothing we're doing today will be with codeine. So Shirley, it looks like we're going to do some wound care here. I need to irrigate your wound, and the doctor wants me to go ahead and obtain a culture as well. Okay, he already let you know about that. Do you feel like you're going to need any pain medication before we begin? No, you're okay. Can you rate your pain on a scale of 1 to 10, 10 being the worst? Oh, you're feeling good. You're only at a 3. Okay, awesome. So I'm going to go ahead and provide patient privacy with a closed door and a thingy curtain. I'm going to perform hand hygiene, and I'm going to get everything ready. So first thing I'm going to do is raise the bed to a working height and lower the bedside rail. Shirley, I need to have you roll into a prone position onto your stomach. Okay, so my client is able to help me. I would put a pillow right here just to make sure that she's comfortable. And we're gonna turn on 3. 1, 2, 3. Perfect. Okay, I'm going to make sure and only expose the part that I need to on my client here. Perfect. So first I'm going to hand hygiene and don fresh clean gloves here. I'm going to go ahead and open up my sterile dressing tray. Make sure I have all my materials ready for my procedure. A biohazard bag to start. I'm just going to go ahead and put that right here in my easy reach. I'm going to get the bed protector out as well. This is just to protect the bed from any irrigant or any drainage. Going to make sure I have a basin here to catch any irrigant as well. All right, so first thing, I'm gonna go ahead and take off the dressing that's already on there. I'm gonna make note of the nurse before me and the time that she did that. And if I were having troubles of getting this tape off, and if there was any like extra goo on there, I'd make sure to use a swab to get it off. Shirley, we're just gonna take this off, and I'm gonna take a look at your wound here. So I would gather all of this, put this straight into biohazard, and then I'm just gonna go ahead and assess the wound. I'm gonna look for color, any slough, any eschar. I'm going to palpate around to see if she's having any tenderness. She says she's not having any tenderness. I'm going to make sure and note that the wound bed is nice and pink. And then I'm going to get rid of these gloves, hand hygiene, and have fresh gloves on. So first thing I'm going to do is I'm going to go ahead and we are going to irrigate. So for that, I need to have normal saline, which is what Dr. Leo ordered. I'm going to open up a 30 milliliter syringe. I'm going to draw up 30 milliliters of that normal saline, and I'm going to go ahead and attach a catheter needle here. All right, Shirley, so I'm going to go ahead and irrigate your wound. Okay, no questions before we begin? No. So perfect. I'm gonna make sure and have my kidney basin available to catch any of that drainage. And I'm gonna start at the superior aspect of my client's wound. I'm going to irrigate 2 inches away from the wound, making sure to use a back and forth motion while I'm doing so. I would use as much saline as I needed until I got a clear return of that irrigant out. Perfect. I would dispose of this per facility policy. I would put my catheter needle into the sharps container, and then I would dispose of this into biohazard as well. Next, I'm going to use a 4x4 gauze pad, and I'm just going to go ahead and clean up around the wound on my client's skin, making sure that there's no irrigant around it, and put that straight into biohazard. So next, I would get some fresh clean gloves on, and I'm going to go ahead and measure my client's wound. So I have a measuring tape here, and I'm going to hold it above and not touch my client's wound. And it looks like we're measuring at about 3 inches in length and 2.5 in width. I would make sure and document that as well. And I do have sterile swabs here. If my client did have tunneling, this is what we would use to measure that tunneling. So I'm gonna make sure and document the length that I got. Clean gloves, and then next I'm going to go ahead and get my specimen culture. So I have a clean, unopened culture here. I have my swab, making sure to take it out, not touch anything, and go ahead and uncap this as well. So when obtaining a culture, it's important I need to avoid any pus, any granulated tissue, slough, eschar, and just choose a portion of that wound that wound bed is nice and pink. So I'm going to use my swab. I'm going to apply pressure, making sure to get a really good culture so we don't have to do this again. Shirley, are you experiencing any pain while I'm doing this? No pain. She says she feels good. And once I'm done, I'm gonna make sure and put that into my tube, not touching the outside of it, putting that on there nice and tight. I'm then going to use my label that I've already made sure it's the same client. I'm going to put the time, my initials, the date, and the site that I obtained that wound culture from. I would make sure and label this, putting it in my biohazard bag, and delegating this to be sent to the lab immediately. So next, I'm going to go ahead and dress my client's wound. So I would have some fresh gloves on, and I'm going to pour the rest of my normal saline into my tray. I'm going to go ahead and get my ABD pad out first, making sure to keep it folded so the inside is still sterile. I'm getting that ready. Having my tape ready, and I'm going to pour the rest of my saline in here. I'm going to use my things here. I'm going to grab my first piece of gauze, making sure to wring it out, making sure it doesn't have any extra saline on there dripping off of it. I'm going to go ahead and fluff that up, bring it to my client's wound here, and I'm going to pack the wound. So when doing this, it's extremely important to make sure that this packing is not touching the outside of the wound on my client's skin, and it's going to stay in there nice and perfect. And then I'm going to come over, I'm going to grab another piece of gauze here. I'm going to make sure and wring this out as well. Bring this over, and I'm going to put it right on top of that packing here. Next, I'm going to use my ABD pad here, making sure the blue stripe is up. I'm going to put it over my client's wound and then tape it into place. Important to go ahead and get at least 1 inch of tape on my client's skin to make sure that this pad stays in place. Doing it on all aspects. One more. Okay. And then I'm going to get some fresh clean gloves, and then I'm going to date, time, and initial this. So the next nurse knows exactly when that dressing was changed and put on. I'm gonna go ahead and clean up all of my materials, putting anything in the biohazard bag that needs to be. Getting rid of this per facility policy. And I'm gonna help my client. Okay, Shirley, we're gonna have you roll back onto your back. 1, 2, 3. Perfect. How are you feeling? Good. Okay, are you experiencing any pain? No pain as your pain scale is still at a 3? Good. So I'm going to make sure my client is comfortable, put her bedside rail up, give her call light, leave with any of my materials, make sure everything gets in biohazard, making sure that my specimen did make it to the lab. And then I'm just gonna go ahead and document what the wound looked like, that the irrigation went well, I obtained that culture and it was sent off, how my client tolerated the process, making sure to say that I didn't see any slough, there was no eschar on my client's wound, and she's now feeling good. Then I would leave the room and perform hand hygiene.